Hello and welcome back to Chilltalk English. I'm Henry.
And I'm Emma. Today is a super useful topic, like real life useful.
The kind of English you hope you never need, but you'll be very happy to have it.
Today we're talking about doctor appointments in English, how to book a visit, explain your problem, answer questions, and understand what the doctor says.
And how to do it even if you feel nervous, tired, or in pain.
Because in those moments, your brain is not like, hello, I would like to practice present perfect.
My brain can barely remember my own phone number when I'm stressed.
Same. So we'll keep it simple, clear, and very practical.
Quick note, we are English teachers, not doctors. This is language practice, not medical advice.
If you have a serious problem, please get medical help right away.
Okay, let's start with a story.
Picture this. You move to a new country. New streets, new food, new weather, new everything.
At first, it's exciting. You feel brave. You tell yourself, I can do this.
Then your body says, surprise!
One morning, you wake up and your throat feels scratchy. You think, maybe I slept with my mouth open.
Later that day, you start coughing. Your head feels hot, you feel weak.
The next day, you notice a strange red rash on your arms. Not huge, but itchy.
You try to ignore it. You drink water, you rest, you Google things. Bad idea.
The rash spreads a little. Your fever comes back at night. You can't focus at work or school.
Now you're thinking, I need a doctor. And then you remember you need to explain it in English.
You know what you feel, you know what hurts, but the words disappear.
You call a clinic. Someone answers and says something fast like, good morning, how can we help?
And you freeze.
You want to say, I have a fever, I have a rash, I'm worried.
But your mouth says, I'm not good.
The person asks, what's the reason for your visit?
And your brain is empty. Not because you're not smart, because you're stressed.
This happens to learners everywhere, and it can be scary.
But here's the good news. You don't need perfect English. You need clear, basic phrases.
Today, we'll build that foundation. Here's how today will work.
First, we'll practice simple phrases for each step. Booking, checking in, symptoms, medical history, questions, treatment, and emergencies.
Then we'll do a full role-play conversation. Henry will be the patient.
Because I have the best confused patient energy.
And I'll be the clinic receptionist and later the doctor.
You can copy us, shadow us, repeat our sentences out loud.
And please remember, your goal is communication, not perfect grammar.
Let's begin with part 1, booking an appointment.
Listener tip. After Henry says a line, you repeat it. Keep your voice calm and slow.
I'd like to make an appointment.
I'd like to make an appointment.
Is there anything available today?
Is there anything available today?
I'm not feeling well.
I'm not feeling well.
I think I need to see a doctor soon.
I think I need to see a doctor soon.
I'm a new patient.
I'm a new patient.
What times do you have this week?
What times do you have this week?
Morning is better for me.
Morning is better for me.
Afternoon is better for me.
Afternoon is better for me.
This feels urgent.
This feels urgent.
My symptoms are getting worse.
My symptoms are getting worse.
Can I speak slowly, please?
Can I speak slowly, please?
English is not my first language.
English is not my first language.
Can you repeat that, please?
Can you repeat that, please?
Can you spell that, please?
Can you spell that, please?
Thank you for your help.
Thank you for your help. Those last phrases are powerful. Asking for slower speech is not rude.
It's smart, and it can prevent mistakes.
Part 2. Explaining the main problem. Simple and direct.
Start with I have or I've been. Ready? I have a fever.
I have a fever.
I've had a fever since yesterday.
I've had a fever since yesterday.
I have a cough.
I have a cough.
I've been coughing for 3 days.
I've been coughing for 3 days.
I have a sore throat.
I have a sore throat.
My throat hurts when I swallow.
My throat hurts when I swallow.
I have a rash on my arms.
I have a rash on my arms.
It's itchy.
It's itchy.
It's getting worse.
It's getting worse.
I feel very tired.
I feel very tired.
I feel dizzy sometimes.
I feel dizzy sometimes.
I feel nauseous.
I feel nauseous.
I threw up last night.
I threw up last night.
I have body aches.
I have body aches.
I can't sleep well.
I can't sleep well.
This is affecting my daily life.
This is affecting my daily life. Notice how we didn't use big, complicated words.
Short words, clear meaning. That's what you need.
Part 3. Checking in at the clinic.
This is the front desk moment. Papers, ID, waiting time. Let's practice. Hi, I have an appointment today.
Hi, I have an appointment today.
My appointment is at 10:30.
My appointment is at 10:30.
My name is Henry Parker.
My name is Henry Parker.
I'm here to see Dr. Lee.
I'm here to see Dr. Lee.
Here is my ID.
Here is my ID.
Here is my insurance card.
Here is my insurance card.
Do I need to fill out a form?
Do I need to fill out a form?
This is my first visit here.
This is my first visit here.
How long is the wait today?
How long is the wait today?
Where should I sit?
Where should I sit?
Thank you.
Thank you.
I like "where should I sit" because otherwise I just stand there like a lost suitcase.
A polite lost suitcase. Part 4. Talking to the doctor. Starting the visit.
This is where many learners feel pressure, so we'll give you easy starter lines. Thanks for seeing me today.
Thanks for seeing me today.
I'm not feeling well.
I'm not feeling well.
I'm here because I have a fever and a rash.
I'm here because I have a fever and a rash.
I'm worried about these symptoms.
I'm worried about these symptoms.
I'd like to understand what's causing this.
I'd like to understand what's causing this.
I'm not sure how to explain it, but I'll try.
I'm not sure how to explain it, but I'll try.
Please tell me if you need more details.
Please tell me if you need more details. That last one is friendly and confident.
Even if you feel nervous inside.
Part 5. Describing symptoms in detail. This is where you sound clear and helpful.
Think about 4 things: when, where, how it feels, and what makes it better or worse. It started 2 days ago.
It started 2 days ago.
It started suddenly.
It started suddenly.
It started slowly.
It started slowly.
It comes and goes.
It comes and goes.
It's constant.
It's constant.
It's worse at night.
It's worse at night.
It's worse in the morning.
It's worse in the morning.
It feels itchy.
It feels itchy.
It feels burning.
It feels burning.
It feels like pressure.
It feels like pressure.
The pain is mild.
The pain is mild.
The pain is moderate.
The pain is moderate.
The pain is severe.
The pain is severe.
On a scale of 1 to 10, it's a 6.
On a scale of 1 to 10, it's a 6.
Scratching makes it worse.
Scratching makes it worse.
Rest helps a little.
Rest helps a little.
Drinking water helps a little.
Drinking water helps a little.
I also have chills.
I also have chills.
I also have a headache.
I also have a headache.
I also feel short of breath sometimes.
I also feel short of breath sometimes. If you only remember one pattern, remember this. It started, it feels, it's worse when.
That pattern is gold.
Part 6. Medical History and Allergies.
Doctors ask these questions for safety. So let's practice calm answers. I have no known allergies.
I have no known allergies.
I'm allergic to peanuts.
I'm allergic to peanuts.
I'm allergic to penicillin.
I'm allergic to penicillin.
I have asthma.
I have asthma.
I have diabetes.
I have diabetes.
I have high blood pressure.
I have high blood pressure.
I'm taking medication for it.
I'm taking medication for it.
I'm not taking any medication right now.
I'm not taking any medication right now.
I take vitamins sometimes.
I take vitamins sometimes.
I had surgery 2 years ago.
I had surgery 2 years ago.
My family has a history of allergies.
My family has a history of allergies.
I'm not sure.
I'm not sure.
I can check and tell you later.
I can check and tell you later. I'm not sure is a complete sentence.
And I can check is very responsible. Not everything needs an instant answer.
Part 7. Lifestyle questions. These questions can feel personal, but they're common.
Let's keep it simple and honest. I don't smoke.
I don't smoke.
I used to smoke, but I quit.
I used to smoke, but I quit.
I drink alcohol sometimes.
I drink alcohol sometimes.
I don't drink alcohol.
I don't drink alcohol.
I exercise once or twice a week.
I exercise once or twice a week.
I don't exercise much lately.
I don't exercise much lately.
I'm under a lot of stress.
I'm under a lot of stress.
I sleep about 6 hours a night.
I sleep about 6 hours a night.
My diet is pretty balanced.
My diet is pretty balanced.
I eat a lot of fast food these days.
I eat a lot of fast food these days. No shame, just information. Doctors need the full picture.
Exactly.
Part 8. Questions you can ask the doctor.
This part gives you control. You're allowed to ask. You should ask. What do you think it is?
What do you think it is?
What could be causing it?
What could be causing it?
Do I need any tests?
Do I need any tests?
What does this test check for?
What does this test check for?
When will I get the results?
When will I get the results?
What treatment do you recommend?
What treatment do you recommend?
Do I need medicine?
Do I need medicine?
How should I take it?
How should I take it?
Are there side effects?
Are there side effects?
What should I avoid?
What should I avoid?
When should I come back?
When should I come back?
What warning signs should I watch for?
What warning signs should I watch for? That last question is so important. It tells you what is normal and what is dangerous.
And it helps you feel calmer at home.
Part 9. Understanding the plan.
Sometimes the doctor speaks fast, so you can use checking phrases. Let me make sure I understand.
Let me make sure I understand.
So I should take this twice a day, right?
So, I should take this twice a day, right?
Should I take it with food?
Should I take it with food?
For how many days?
For how many days?
Can you write it down, please?
Can you write it down, please?
Can you say that again, more slowly?
Can you say that again, more slowly?
What if I miss a dose?
What if I miss a dose?
Is it okay to work and study?
Is it okay to work and study?
Should I rest at home?
Should I rest at home?
When should I start to feel better?
When should I start to feel better? Perfect! You don't need to pretend you understand. You can ask for clarity.
Clarity is safety.
Part 10. Emergency phrases.
We'll keep these strong and simple. If you ever need them, speak clearly and ask for help. This is an emergency.
This is an emergency.
I need help right now.
I need help right now.
I'm having trouble breathing.
I'm having trouble breathing.
My lips are swelling.
My lips are swelling.
My face is swelling.
My face is swelling.
I have severe pain.
I have severe pain.
I feel like I might faint.
I feel like I might faint.
Please call an ambulance.
Please call an ambulance.
I need the emergency room.
I need the emergency room. Even practicing these once is worth it.
I agree. It's serious, but it's real life.
Part 11. Ending the appointment.
Let's close politely and clearly. Thank you for your help.
Thank you for your help.
I'll follow your instructions.
I'll follow your instructions.
I'll take the medicine as directed.
I'll take the medicine as directed.
I'll come back if it gets worse.
I'll come back if it gets worse.
Should I book a follow-up now?
Should I book a follow-up now?
Can I get a copy of the notes?
Can I get a copy of the notes?
Have a good day.
Have a good day. Nice, simple, respectful.
And very doable.
Now we'll put everything together with a full practice conversation.
Listener challenge. Shadow both voices. First, copy me, then copy Emma. Then, try the full conversation again.
Scene. Henry calls a clinic because he has a fever, a cough, and a rash that's spreading.
And I'm gonna try not to sound like a scared robot. Nervous laugh.
No promises.
Hello, I'd like to make an appointment, please.
Good morning. Thanks for calling Harbor Health Clinic. How can I help you today?
I'm not feeling well, and my symptoms are getting worse.
I'm sorry to hear that. Are you a current patient with us?
No, I'm a new patient. This is my first time calling.
No problem. What's the reason for your visit?
I have a fever and a cough, and I also have a rash on my arms. It's itchy, and it's spreading a little.
Thank you for explaining. When did it start?
The cough started 3 days ago. The fever started yesterday night. The rash started this morning.
Okay. Do you have trouble breathing?
Not right now, but sometimes I feel a little short of breath when I walk fast.
Thanks. That's important. If your breathing gets worse, or if your face or lips swell, please go to the emergency room right away.
I understand. Thank you.
Let me check our schedule. We have an opening today at 4:20 in the afternoon. Does that work for you?
Yes, that works. Thank you for fitting me in.
Of course. Can I have your full name and date of birth?
My name is Henry Parker. My date of birth is April 14th, 1997.
Thank you. Do you have health insurance?
Yes, I do. Should I bring my insurance card and ID?
Yes, please. And since you're a new patient, please arrive 15 minutes early to fill out a form.
Okay, I will arrive 15 minutes early with my ID and insurance card.
Great. One more question. Do you have any known allergies?
I'm not sure. I don't think so.
That's okay. If you remember anything later, tell the doctor. We'll see you today at 4:20.
Thank you. See you at 4:20. Goodbye.
Goodbye. I hope you feel better soon.
Good job. That phone call is a big step for learners.
Now, let's continue the story. Henry arrives at the clinic,
I'm holding my ID like it's a golden ticket.
and I'm the front desk person again.
Hi, I have an appointment today at 4:20.
Hi, welcome. What's your name?
Henry Parker.
Thank you. Is this your first visit with us?
Yes, it is.
Great. Please fill out this form. And may I see your ID and insurance card?
Yes, here you go.
Thank you. The wait time is about 20 minutes. Please have a seat.
Thanks. Where should I sit?
Anywhere in the waiting area is fine.
Okay, thank you.
Now, Henry goes in to see the doctor.
I will try to look calm and normal. Inside, I'm like a washing machine.
I'm the doctor now. Hi, Henry. I'm Dr. Lee. What brings you in today?
Thanks for seeing me. I'm here because I have a cough, a fever, and a rash. I'm worried about these symptoms.
I understand. Let's talk about the cough first. When did it start?
It started 3 days ago. It's worse at night.
Do you have chest pain?
No chest pain.
Any sore throat?
Yes, my throat hurts when I swallow.
Okay, now the rash. Where is it?
It's mostly on my arms and a little on my neck.
Does it feel itchy or burning?
It feels itchy. Scratching makes it worse.
On a scale of 1 to 10, how uncomfortable is it?
Maybe a 6.
Do you have any allergies?
I have no known allergies, but I'm not completely sure.
That's fine. Are you taking any medication right now?
No, I'm not taking any medication right now.
Okay, I want to check your temperature and listen to your breathing.
Okay.
After that, we may do a simple test.
What does the test check for?
It checks for a few common infections. We can usually get results quickly.
Okay. When will I get the results?
Today. And here's the plan. Rest, drink plenty of water, and I'll recommend medicine to help with the symptoms.
Let me make sure I understand. I should rest, drink water, and take the medicine as directed.
Exactly. Take it twice a day with food for 5 days.
Twice a day with food for 5 days. Are there side effects?
It can make you sleepy, so avoid driving if you feel tired.
Got it. What warning signs should I watch for?
If you have trouble breathing, if your face or lips swell, or if the fever gets very high, go to urgent care or the emergency room.
I understand. Thank you for explaining clearly.
You're welcome. Let's schedule a follow-up in 1 week if you're not better.
Should I book a follow-up now?
Yes, the front desk can help you.
Thank you for your help.
You're welcome. Feel better soon.
And that's a full appointment, from phone call to doctor visit.
Notice the language. It's not fancy. It's clear.
Clear English can protect your health.
Also, you can repeat important information out loud, like Henry did. That helps you remember and confirms understanding.
Let's do a quick confidence reminder. If you forget a word, you can still communicate.
You can say, I don't know the word, but, and describe it.
Or use simple comparisons. It feels like burning. It feels like pressure.
And it's okay to ask the doctor to speak more slowly.
Before we finish, let's do a mini review. Emma, what are the 3 most important actions in a doctor visit?
1. Say your main problem clearly. I have a fever and a rash. 2. Give simple details. When it started, how it feels, what makes it worse. 3. Ask questions and confirm instructions. So I take this twice a day with food, right?
Perfect.
You did something important today. You practiced real-life English that can reduce fear and confusion.
Save this episode and practice again.
Try shadowing while walking, cleaning, or on the bus. Quietly is fine.
Your mouth needs training, not just your eyes.
And if you want, write down 3 sentences you can always use.
I'm here because...
It started.
What warning signs should I watch for?
Thanks for spending time with us on Chilltalk English.
Take care of your English and take care of your health.
See you next time.